Research shows that birth control pills can shrink your hypothalamus. Let's talk about how that affects you and what you can do about it. Studies show that birth control pills do shrink your hypothalamus. Now, I find it really interesting that research has finally proven what I've seen for over 20 years. Many women who've had a long history of birth control use with hypothalamic dysfunction. So what's actually going on? And what did the researchers actually find? Well, the researchers found that women who used birth control pills actually had a smaller hypothalamus, as demonstrated on an MRI, than women who did not use birth control pills. First of all, the researchers did not want to indicate what implications of this shrinkage of the hypothalamus was, but I'll tell you what they're seeing on the MRI is a lack of use. The hypothalamic pituitary ovarian axis, which is the communication network between your hypothalamus, the middle manager we call the pituitary gland, and your ovaries, which produce your female hormones, is put to sleep when you're taking the birth control pill. The way the birth control pill works is to give your body high enough levels of both estrogen and a progestin so that your hypothalamus thinks you're basically pregnant. Being suppressed by high levels of synthetic hormones, the hypothalamus does not tell the pituitary gland to stimulate your ovaries to ovulate so you don't get pregnant. Birth control pills disrupt the communication network between the hypothalamus, pituitary, and the ovaries. So what does that mean? Well, it does not only affect your current and your future fertility, but it also affects your natural, normal hormonal production. Birth control uses synthetic estrogen and synthetic progestin. While synthetic estrogen mimics natural estrogen, synthetic progestin does not replace your natural progesterone. Progestins are testosterone derivatives which affect your uterus but do not protect the rest of your body tissues in the way that natural progesterone does. So what's the long-term effect of having your hypothalamus shrink because you've been using birth control pills? Lower fertility, diminished sex drive, mood and memory issues, sleep dysfunction, metabolic issues leading to weight gain, insulin resistance, and circulatory disorders. When I was a young woman becoming sexually active and the birth control pill was offered to me, I was told at that time to be sure to take a break from the pill every few years and not to use it longer than 5. Now, somehow back then, doctors appreciated that the hypothalamus pituitary ovarian axis would be disrupted. These crucial organs needed to talk to each other at least once in a while if you were going to preserve your fertility. And then sometime in the 90s, it was determined that women really didn't need to have periods at all. Not all the time. And perhaps they didn't need to have periods every single month. Perhaps blocking the hypothalamic pituitary ovarian axis wasn't actually a bad thing, because we have infertility specialists that could get you pregnant anytime, artificially. But it's so much more than infertility. When your hypothalamus pituitary ovarian axis shrinks, when it's no longer functioning, it affects other vital body functions. For instance, it affects your stress response, run by your hypothalamic pituitary adrenal axis. It affects the hypothalamic pituitary thyroid axis, how your body controls your metabolism or how fast you're burning energy. It affects your memory and your mood. Why is that? Because your hypothalamus controls all your hormones and many other vital body functions. Your hypothalamus controls your body temperature, your weight set point, which is basically how much weight is ideal for your body, how fast you produce cellular energy and burn calories. It affects your digestion, your hunger mechanism, whether it's going to store fat in your fat cells. It affects your memory, your ability to access memory, both long-term and short-term. It affects your mood. Research has also proven that people with chronic depression or bipolar disease have a shrunken hypothalamus, about 5% smaller than people who do not have these mood disorders. Again, the hypothalamus is affected in many ways by taking medications like the birth control pills or other environmental toxins, and by brain injuries that interfere with the blood flow to the hypothalamus. When your hypothalamus is disrupted, it affects the way your body functions and basically the way you feel. Women will describe when they've taken the birth control pill a very common side effect. Their sex drive or libido is lower or non-existent. And again, it's because the hypothalamus is shrinking and it controls your sex drive and your ability to reproduce. Because of the birth control pill, your hypothalamus believes you've been pregnant for years. It doesn't make any sense to reproduce or stimulate the basic biological sex drive. But it's so much more than that. Our sex drive is more than our reproductive urge. Our sex drive is tied to our pleasure center, which controls dopamine. If your hypothalamus is dysfunctional because of the birth control pill use, you make less dopamine. People who make less dopamine or their dopamine receptors are genetically altered tend to have addictive personalities. They're looking for substances or activities to actually stimulate the dopamine. Your hypothalamus controls so many things. It's a wonder why we would do anything to interrupt its function. Now, if you've been taking the birth control pill for any amount of time, is there hope? Is there a chance you could heal the damage that the birth control pill might be doing to your hypothalamus? Yes. I've treated women who've used the birth control pill for over 2 decades, come off the birth control pill, and have difficulty with their fertility, be able to heal their hypothalamus using Genesis Gold. Yes, I did create Genesis Gold exactly for this reason, to heal the hypothalamus, whether your hypothalamus is damaged by toxins or medications or shrunken from birth control pills. What I found is that with time, the hypothalamus can heal. It takes a minimum of 3 months, and that's if you're basically healthy. If you've been out of balance for many years, you can expect it to take 1 month per year you've been ill to heal your hypothalamus and get it functioning optimally. One of my most amazing cases as an integrative practitioner was taking care of a woman who had no hormones. She suffered from something called pan-hypopituitarism and made none of her own hormones. No adrenal hormones, no thyroid hormones, very little insulin, no sex hormones. In fact, she never started her period on her own. Basically, her pituitary was not putting out any of the hormonal stimulus to get her lower endocrine glands, the adrenals, thyroid, and ovaries, to make any of their own hormones. And of course, it's the hypothalamus that controls the pituitary gland and is negatively affected by this lack of hormone production. And it begins to shrink as well. So this particular patient was using synthetic hormone replacement therapy for her adrenals, thyroid, insulin resistance. She was on birth control pills to induce her periods. She was also taking other medications like sleeping pills because the hypothalamus controls your circadian rhythm. She was also depressed and had panic issues. She was taking antidepressants and anti-anxiety medication. And she'd been on all these synthetic hormones and medications for nearly 2 decades. When she came to see me, she wanted to try a more natural approach. She wanted to be able to use bioidentical hormones if possible and nutritional supplementation. So I started working with her and replaced all of her hormones with bioidenticals. Plus, I added nutraceuticals to help her sleep, her depression, her anxiety, as well as her insulin resistance. Over time, we replaced everything, all our medications, with natural alternatives. But she was still taking a lot of stuff. Essentially, she was dependent on the natural therapies rather than synthetic, which were probably safer, but still not making her own hormones. So when I finally created Genesis Gold, I offered it to her, and she gave it a try. Within 18 months, this woman began making all of her own hormones. We got her off all of her supplements, all of her bioidentical hormones. No adrenal, no thyroid support was needed. Insulin resistance was completely reversed. Her weight was normal. She was sleeping through the night. She was no longer depressed or anxious. She actually was having periods on her own. At this point, I told her she probably could get pregnant, so she might want to use some type of barrier contraceptive like a condom or a diaphragm if she didn't want a child. And she laughed because she'd been told by her healthcare providers for over 2 decades that she was infertile. I told her, "But you're fertile now." She didn't believe me, and at the age of 43, she had a healthy baby boy. So, if the woman with no hormones, basically no hypothalamic pituitary function whatsoever, after just 18 months of taking Genesis Gold, can be weaned off all of her hormone replacement therapy and all of her supplementation and have normal function on her own, if she can do it, so can you. If you want to learn more about how to heal your hypothalamus naturally, I'll put a link in the comments below.